Welcome, everyone, to Writing About Online Sources, Big Data in Healthcare Edition. I'm Dr. Basil Considine. I am here from the ACU Online Writing Center, and we are going to talk about how to find and write about big data, with a particular focus on healthcare. If you are new to the Writing Center, we work with students at a variety of different points in the process. You can come in and make an appointment with us virtually to get feedback on how you are interpreting a assignment when you're at the early brainstorming stages. You can come in with a partially written draft with a page or 2 or 5. You can come in with a complete draft that you submit to us for feedback. Or you can come in after you've finished a project, perhaps if you are working on a paper and you want to see how you might improve it before you start on the next assignment. Great, you can do that. You just give us some notes about that context, and that's what you're specifically interested in. You could be working on something that's going to become part of your dissertation and be building that document over time and come and see us as much as once or twice a week. That's all fine. We also have webinars such as this. But the bulk of our appointments, most students coming to us for direct feedback on their writing do this through what we call asynchronous appointments. What's an asynchronous appointment? It's an appointment that doesn't take place in real time. You sign up for an appointment slot, say at 11 p.m. tonight, and by 11 p.m., you upload your paper to turn it in through the Writing Center Canvas site. And then we come in, we look at it, we give you feedback, and within 24 hours of that appointment time, you will get an email from us saying, hi, we've looked at your paper. Here's some comments and suggestions. Here's the link to the feedback, or here's the attached Word document with track changes and comments for you to look at and decide what you're going to do with that. Most students work with us through this because we have these online programs where people may be doing their work at all hours of the night. So if you have a 11 p.m. appointment, but you finish your assignment at 6 p.m., great. Being ahead of the curve is good. You can upload it. And what I do is I go ahead and I look early on the week, and if I see that something's in a little bit early and I have some free time, I'll just do it, because that gives me a little bit more flexibility later in the week, just like you're finishing that draft early gives you more flexibility. We also have on the Writing Center website a whole set of sample papers, blog posts on different topics, special resources, and an archive of every webinar that we've done just about. Speaking of webinars, this is the second to last one in our Fall 1 2020 schedule. Don't worry, we've got a whole new slate coming for Fall 2 2020, including some brand new ones that were requested by students such as yourselves. So the last one on our sequence here is writing about theoretical and conceptual frameworks. And if one of the things that brings you to this webinar today is that you are a doctoral student or working to become a doctoral student, and you're thinking you might be writing a dissertation using big data, or a doctoral project to do a quality improvement project based on big data, you probably want to come next week where I'm teaching writing about theoretical and conceptual frameworks. This dives deep into a very important part of any large-scale project, which is how you decide what things matter. If you are using a particular theoretical approach or using a model as part of your conceptual framework, this will tell you, oh, these types of details are important. These ones are the things that we're going to pay attention to. And so deciding on your theoretical and conceptual framework could lead you to do a vastly different dissertation. Here's a quick example for me. I wrote a musical and military history of the island of Mauritius in the Southern Indian Ocean. One of the things that figured into my conceptual framework was this idea of the insider-outsider perspective, that you gain some things by looking at something and not being involved, and that by going and doing them, you also learn things that you would miss if you were just taking the outsider view. Now, for me, it happens that Mauritius is a beautiful tropical island in the Southern Indian Ocean. By my picking a conceptual framework that involved and emphasized the importance of having this double perspective. That meant that I had to go to this island and be on this island where it's summer in the southern hemisphere, while all of my colleagues in Boston were getting snowed on. So I hope you'll agree that a conceptual framework can really change what you do and how you do it. And I'll be talking more about that next week. Let us continue to our main focus today, just talk about big data. This will be a shorter webinar. We usually go for an hour, but for these very focused ones, we can, if there's a large group of people looking for feedback and wanting to discuss these things, but I have a feeling it's going to be a shorter, more direct one because we're really zeroing in on a particular concept, particular type of data. So let's focus on our two learning objectives here. The first is to understand the concept of big data, and the second, to understand how to find, cite, and reference big data resources. So that first one, well, if you're in Health 627, you probably went to a presentation earlier this week about what big data is and about how it gets used in healthcare, but let's start from the basics. Big data is a kind of umbrella, omnibus term to refer to a large volume of data. Could be structured, could be unstructured, could be both, that's usually generated during everyday functions. For example, there is a bicycle rental service where I live, and the company that runs this has GPS trackers on the bike. Now, the main purpose of those trackers is to find where the bike is in case someone steals it. However, you can also do things and see, okay, well, where are people using the bikes the most? How far do they go? Is there a route where a lot of bikes are going that way and maybe we should put more bikes there? That's an example of the kind of thing that you can do with big data. And in fact, they have used this to optimize the routes. When they first rolled out this, they had lots of stations and all over town. And then they discovered that they weren't getting many customers in certain neighborhoods. So they moved those bike stations to other places. And they've been working on maximizing their use. You know, more money, more transactions, same amount of equipment. So what is structured data? Well, structured data is data that has some sort of standardized format. If you think a cookbook recipe, usually it has, oh, here's a list of ingredients. And then here are the instructions about how to cook it. And perhaps here are some things that you should pair it with, whether those are beverages or desserts or other things. Or you might look at an automobile inspection form. You know, I happen to own a car that's made by Toyota. There is a form that every Toyota dealership I go into, they have that same form and they write things in the same places and they use the same codes because it's all going into this manufacturer billing system for the dealership to get paid. So they all use the codes that Toyota says that they should use. That is an example of standardized format for your data. Now, that kind of data has always been out there in some shape or form, but one of the big things about so-called big data is that it being electronic and in formats that is, compared to say 20 years ago, relatively easy to share. That opens up a lot of possibilities, and things that used to take a whole lot of effort can be very easy if you have the access and the know-how. By the way, if you look at the third bullet, you'll see a typo there. So that is a reminder for all of us to do proofreading. And in the context of big data, one thing that you will always want to do is find who the maintainer or overseer or simply the data manager or data officer for the repository you're trying to work for. You want to know who those people are, because often you'll have something where you're trying to search for something, and sometimes you make a typo, like you see in the third bullet. Instead of standardized, it says standardized. And you don't realize, because you're doing all these searches and stringing a lot of stuff together, you don't realize what it is that is not giving you the thing that you want. And they might look at your request and say, oh, so we call that this thing here. I did some work in the United Kingdom. I did some work in Mauritius. I did some work in France. A lot of the medical systems, once someone explained, I knew what they were talking about to me. But before that, I said, what's that term? I haven't heard of that before. Strange. Why don't you guys have this thing? And they said, well, we never heard of that. And then we discovered, oh, they do have those things. It's just different names, or perhaps under a different department than I was expecting. And that's why you want to talk with the data officers. Now, unstructured data doesn't have a standardized format. And that doesn't mean that you can't add that. It just means that however you're getting it, it's not dividing it into those easy areas. Now, if you've ever done any work with electronic medical records, you know that they can be highly variable between different systems. And if you're a nurse who goes between more than one hospital system, you're probably aware of some of the sometimes frustrating things where they all use different shortcuts for things. But there is some standardization usually with the insurance codes, because they're industry-wide standardizations there. So one of the things that can happen is that you go in and you take an unstructured data set, you analyze a bunch of the things, and then you create an algorithm that will go through and standardize some of it, like looking for certain codes and say, okay, if this code is here by itself, meaning letter not being part of a word, mark that as this type of data. So you might have something like pulling treatment data out of paragraphs. Now you have to be careful about that so that you don't accidentally get something that says does not have this condition that you're searching for. But again, this is one of the reasons why you work with the analyst or operator or officer who is in charge of data. So if we talk about that a different way, the big data is the raw or mostly raw materials that you use for assessing and improving processes. These are being electronically recorded through all these things that happen to connect through the internet today. You can have data that's being produced by so-called smart fridges. You can have data that's being produced by smart thermostats or by the Alexa assistant, or it could be as simple as, well, here's a contemporary thing, contact tracing. Now, if you'll pause for a moment, I'm just going to check one thing. There we go. All right. Another way to think about big data is that it's a means, the medium that we can use to identify trends and patterns that would go beyond a single person's powers or their easy powers of observation. If you're trying to find out what happens in an entire healthcare system, even a very observant person probably can't be there all the time to look at some of the things that you might notice. And you can also use it to look for problems and inefficiencies that other people aren't seeing or that have assumed are always there and always will be there, but you say, but wait, I think we can do better. So one of the things that happens is that you start by having data that's being collected anyway. And then you find a way of zeroing in on the things that you want. And so you're usually extracting the data you work with from a larger stream of ordinary electronic records. And if you think about it in a healthcare context, because of HIPAA and other things, you don't want to just be handing off patients' raw data to anyone on the street. Well, there's a lot of private information there, and there are good reasons why that shouldn't be spread around. But if you're working with, say, the hospital data officer, you could give them a request and ask, could I get anonymized reports from every patient who had this? You know, every baby in the NICU who had this thing, or who came in and was under this weight, and thus derive a more manageable stream of information to look at. So for example, I told you I own a Corolla. Give me all the maintenance records for 2013 Toyota Corollas that required dealer repairs within the first month of ownership. Or if you're in human resources, get me the punch in and punch out times for every worker who's logged paid and unpaid overtime in 2019. If you're trying to keep the payroll down, the payroll costs down, and you do something like this, you might discover, yeah, we're just paying overtime every Saturday for some reason. Why don't we hire someone else here so that person can have a break and the new person will pick up some hours? So what will you do with this data? Now, you could just tell the data officer, I would like this thing, and not explain. But I recommend that you ask them um, uh, first what kinds of things that they have, perhaps what kinds of things they provided before, so you know what's doable and reasonable, but also tell them about what you're looking to try and discover, because they might make suggestions about things you don't know or don't expect, or call your attention to something that's already available. Now, once you get that initial stuff, depending on how you're working with them, you might have your own analyst who goes and parses this data and searches it for things and runs reports for you. Or you could be working with the officer directly because they're in-house and available to you, and come back with questions like, oh, tell me the average number of staff hours and build back costs for a data set. Or give me a list, including quantities of all the parts that were used in these repairs with the external and internal prices. I have a friend who works for BMW in Germany, and he works on what might be vaguely understood as customer service, but really his division is tasked with looking at all the customer complaints and the repairs early on in ownership and finding out what is breaking, what is not functioning the way we think it should, that is costing us money, and then let's go and find out. So really it's some combination of cost cutting and quality assurance, as well as that customer end. But their job is to analyze all the customer reports and the maintenance reports, and to get the leads to go and do all these other things. And sometimes you find something like, oh, this machine's calibration is off, therefore we should recalibrate them more often, for example. An important thing in radiology, you definitely want to have those machines calibrated and well. And if you're having diagnostic or treatment errors because it's not, and you're parsing those reports, find, hold on, there's a pattern here. About 5 months after we get this aligned, we start having issues, and the films aren't getting read correctly, or whatever the case may be. That can give you a clue about what you should be doing. If we go back to the earlier request about punch in and punch out times, usually people who are doing these data pulls will record exactly how they got that data, so they can run the search again, updated with new dates, or with more particular requests like, oh, give me a spreadsheet with some bar charts visualizing how the data is arranged for all those people who were logging overtime last year. And then do further analysis like, tell me what percentage of these requests were planned overtime, where it was understood in advance. Now, let's bring this back to healthcare. You could do something like, give me all the data on ER presenting patients with fevers and acute, again, watch for typos, because if you're going to give this to the data officer saying acute instead of acute with that typo in there, you probably wouldn't get what you were looking for. So sometimes when you find, we thought we would get that, it wasn't there, you just need to go and check something simple like, oh, was there a typo there? Or did you use a different term than they were coding it? And then you can follow this up with questions like, how many of these patients were readmitted in a 1 week period? Or what was the average net cost to the hospital for their treatment? And what did billing actually recover from that cost as assessed 6 months after they were treated? Now, you can bet that with current global health conditions, there are a lot of data officers who are looking at things that are coming in from COVID and trying to figure out, okay, what is this actually doing to our resources? What's our average utilization? What's our utilization in different times a week? It probably doesn't surprise you that there are some times where hospitals tend to be busier than others. if we're outside of normal working hours, if you're in a college town, Friday night, Saturday night, you may get a lot of visits from college students. Fewer of them on Monday morning. And this is true for other segments of the population too. People are more likely to come when it is convenient for their schedule and there aren't other things going on. And you can discover a lot to inform staffing, for example. All right, what is the average annual giving of our church congregation, and how does that correlate to their zip codes and how many children that they have? Can you map that onto the calendar? This question is for the MDiv student I saw on the RSVP list. So, little background for you. I went to seminary at Boston University School of Theology. There was a fair number of my classmates who worked in information technology. And boy, the things that they potentially could know about the parishioners at the church that they were working at, because they realized, oh, at some level, we are recording who is giving what, as well as other things about them. Now, sometimes that's very individual things like, okay, who has food allergies so we don't accidentally have, say, a peanut butter cookies at the Christmas party and accidentally poison some people. But there are also other things that you might be encoding there. And yes, someone with just a spreadsheet tracking all this stuff could run some numbers on, let's find out what the average age of the parishioners is. But the idea with big data is that you're collecting lots of things as part of your normal operations that you can look at later to search for particular things, to identify trends, to discover opportunities for improvement. So, for example, at one church I used to work for, they discovered that their biggest givers did not live near the church. These were people who had moved sometimes several towns away, but they still came back to that church. Clearly, it meant something to them, especially since they were driving through traffic in a major metropolitan area to get there. Now, what might you do with that data? Well, perhaps that might lead you to write some thank you cards or have the development team write some thank you cards. Perhaps it might tell you that, when parishioners are moving to other areas, you want to invite them to stay in touch for more than just personal reasons. What you do exactly is up to you and your organization. But big data makes a lot of these discoveries and testing what happens next a very easy reality to access. At this point, we're going to switch to the second learning objective that we have here, which is to explore how to find, cite, and reference big data resources. If you just joined us, don't worry, the whole thing is being recorded and being placed online, but if you have any questions or any quick things you want to ask for clarifications, please feel free to ask. I encourage questions. I might not get to them immediately, but I will certainly circle back, so feel free to type away in the chat room. So we are at this point going to turn to a particular assignment in the HCAD program from HCAD 627. This is an assignment that asks students to write a 3 to 4 page paper in APA format doing a couple things. This is the big data and healthcare assignment, the focus that we're going to be using for the next part of this webinar. You need to identify at least 5 to 7 specific sources of big data. So you can't just say, oh yes, electronic medical records, that's too general. 5 to 7 specific sources of big data found in the healthcare environment today. You need to identify the specific data sources that feed into that, how it's being gathered or how you will be gathering it if you're going to do that, what kind of records or communications are made. For example, I have a colleague who is a physician and at a level 1 trauma center. So they have some nice gear there, some up-to-date gear. When she is at home, she can log in and check in on a patient, whether she's on call and is looking up because someone else is calling her, or if she just wants to make sure that they got passed off to the next thing and after she checked out for the evening. And she can log in and see, oh, here is their heart monitor. Here's what's going on with their heart right now. Great, nice and steady. Huh, that's a little bit irregular. So that is a machine whose readings are being transmitted to a computer somewhere, and that computer is recording that information in a database, and that she can access through a website for the hospital, of course, with multiple logins and stuff, because patient privacy is really important. Now, that same data that is coming in is also being recorded in a patient record somewhere as, okay, this is a patient who has checked in for such and such a thing. So you could go and approach a hospital and say, hi, I am working on X. Let's go ahead and say, I am working on type 2 diabetes. I am trying to find information about these things and patients with those things, and do they correlate with this? Can I get some data? Now, depending on the relationship you have and how busy they are, you may get a different answer there. But more and more, what is happening is that large hospital systems and medical centers generally are working with partner organizations to collect this data and to create what's called a clearinghouse to manage access, so that the people who are doing the hospital day-to-day aren't getting these requests all the time. Now, one of the other reasons why you might have a data clearinghouse is because it allows the clearinghouse to collect similar types of data. Oh, we work with 5 hospital systems that all use this type of equipment. So they have agreed to share their anonymized data, and someone can come in and, depending on, has this being commercialized in the sense that they're charging money for it, or if this is being made available as a public access thing, how you might get access to. Because usually it's not just something that's posted online for anyone to use, but there are some cases for that. Usually you have to go through at least a little bit of a gatekeeper, because they want to keep the material from circulating too wildly. So more about this assignment. What is it asking to do? Compare and discuss the benefits and disadvantages for healthcare professionals in dealing with the increasingly available large amounts of data, and predict the changes you envision to healthcare based on the availability and analysis of big data. In your prediction, address the viewpoints of patients, providers, and payers. So this is 3 to 4 pages of content, the body of the paper, not counting the references, not counting the cover page. So we're talking 750 to 1,000 words. Now, looking at this, you're probably going to have an introduction paragraph, and then the second paragraph or two be discussing the sources of big data that you have identified. Great. That's going to be just that introduction and discussing this. It's probably going to be close to 1.5 pages. That's half or almost half of your paper already. So if you look at the rest, compare and discuss the benefits, disadvantages, predict the changes you envision, that's going to be probably 2 paragraphs or so each. And doing that, you'll have your paper basically written. So use this assignment as a blueprint for planning your paper, and make sure you don't spend too much time on any section, because you only have 3 to 4 pages. So if you spent, half a page each on discussing each big data source, you're going to run out of space. So a couple sentences is probably more than enough. Let's take a look at the rubric to see if there's anything else before we go into this. This looks like there is one thing that was not mentioned or wasn't explicitly mentioned in the instructions. I'm going to jump back here. So it does say that predict the changes you envision to healthcare based on the availability and analysis of big data, and look at the viewpoints of patients, providers, and payers. But when we go to the rubric here, we see that the third item, paper compares and contrasts the disruptive category to be implemented with the current business model in the physician's office. So this is one of the reasons why you want to always look at the grading rubric, because this is telling you some additional information. And by spotting it now before you start writing, when you create your outline, you can include that. So you make sure that you address this as part of it, rather than writing a perfect 4-page paper and then looking at the rubric and realizing, oh shoot, I need to write another half page or a page for this. I'm going to need to cut some stuff. Oh no. So you can save a little bit of unnecessary work by looking ahead at the rubric here. All right, so some questions to ask when you know that there's a data set there that you're going to try and get access to. Start out with this: is this a fully public data set? Do you need to pay to get access? Do you need to get approved to get access? Do you need to be employed by an organization to get access? And contrarily, is this a restricted use data set? Meaning, is this something where you can only do certain things with this, or you need to work with someone, as opposed to they're just handing everything over and saying, hey, have fun. So that question of restriction leads us to, who are the gatekeepers or data managers that you need to go through? If you're doing research in a medical setting, very often a hospital will have its own institutional review board because they're used to getting this kind of request. Now, if it's involving big data and they haven't done that before, they may want to have some people at the table who manage and oversee this and who are in charge of HIPAA compliance and things like that. But it's actually not that terribly involved or stressful a process usually. It just often takes longer than you like because these groups only meet so often. There's also a question of what anonymization, if any, needs to take place. Now, I know that many of our Doctor of Nursing practice students do quality improvement projects and initiatives that might work with patient data records, chart review, perhaps. And one thing you always want to make sure is that that data is anonymized. So it's not one person looking up and copying down or printing out 200 medical records. That would normally go through a data manager or analyst of some sort, who would not only extract that data from you, but will be charged with making sure that all patient data was thoroughly anonymized before it passed out of their hands to you. So how do you go about finding this? Well, one way is to just do some reading, and when you see references to it, follow the links and citations, or to go to literature specifically about it, like this Forbes article, or you could just start searching online. I'm going to tell you about a journey that I went through recently to find some available data sources, and then we'll talk about some large repositories. So I read a news article about Mount Sinai Hospital. Mount Sinai Hospital is a hospital network in New York. Lots and lots of research coming out of there. They just created and hired, well, recently they created and hired for a chief data officer position. All right. Well, I went and read that article, and in that article, I noticed they talked about the kinds of things he would be working on, and they referred to their hospital's big data project. All right, so I clicked on that link. And on the website that brought me to, there was a link to talking about their corporate data warehousing partnership with an outside company. All right, so I followed that link. That brought me to a website where they had listed innovation partners, which is how they're calling, here's where you go if you want to use this data. And after following that, I clicked on the Get Started page. And there I found a form to fill out to request an agreement to get access to their data. Basically, it's a, tell us who you are, tell you what you're doing, this kind of thing. And there's a fairly brief screening process to get access to the data. They're not going to let you, log into the hospital system directly. This is going through their data warehouse partner. So it is charged with administering this access and making sure that the data is anonymized and not misused and things like that. So here this might look like a lot of work to go through 5 different steps to find where the data for this hospital system is. But in practice, this took me somewhere around 5 minutes because I was reading these articles as I went along. If I'd just been searching for the links, I would probably have done it in 2 or 3. So this is how I found one set of data. One of the largest hospital systems in the country has lots of their data available through this company through a website where you can request access to parts of that data. There are also, if you're working on data improvement initiatives or just doing general research on things, you can look at large government repositories. I've presented here on the slide a couple selections from the United Kingdom's national healthcare data. Now, this is what we call a rich data set because it's got a lot of stuff in there. The United Kingdom has the National Health Service, and because the government has this large public healthcare system, they have lots of stuff by various legal mandates that is supposed to be open and accessible to the public. So you can find lots of stuff, statistics, raw data of many sorts on their website that you wouldn't find or would be less likely to find coming from a US repository, just because a different system there. So if you're looking for certain kinds of things and you get told, well, we don't really collect that here, there might be another place in the world that does. Now, the US government has a data clearinghouse portal itself. It's very simple, data.gov. And I've included here an example of the older adults health data collection. So if you're working in gerontology or any sort of later in life care, you might be interested in the kind of projects you could do using this data set. There's a lot of very diverse stuff in here. You can find census data, you can find stuff about traffic, about the ocean and weather in data.gov, but most importantly, you can search for things and see, okay, do they have stuff on this kind of hospital? Do they have this kind of health thing available? So let's talk about citing and referencing. And if you're here with us and you have an assignment or meeting you're getting to, don't worry, we're in the home stretch. This is going to be a shorter webinar today. So I've linked here the APA style page for citing data sets here. In short, we're following the basic guidelines of any APA citation. We start with, for the reference entry, who wrote it, when was it published, what's it called, and how do you find it? Now, if we look at this here, we'll see, okay, there is a little bit more information here. There's the ICPSR 21600 version V1 coding. Okay, so that's identifying the specific version of that, or the report number. There's a note in square brackets saying data set, and then ICPSR is the publisher here. All right, so this is an example of a data set reference. Let's talk about something very topical. The COVID-19 case surveillance public use data. This is something that's getting a real workout and constantly expanding in this country. But our interest here is how this would look in a reference and how it will look in a citation. Same order, Centers for Disease Control and Prevention, publication year 2020. What's it called? The COVID-19 case surveillance public use data. We mark it in square brackets as a data set, and then we have the link to access it. Now, you might ask, well, how do I get that publication date? Well, usually these data sets will have a note on them saying updated such and such a day, or such and such a month, such and such a year. And so that's where we pull the year from. But sometimes they don't. And if they don't, you put N period D period, stands for the Latin non datum. All it means is not dated. N period D period. If you got multiple things from the same year or multiple things that are not dated from the same organization, it becomes N period D period hyphen A, N period D period hyphen B, and so on and so forth. And how would you cite that in the body of your text? Same way as any other thing. For example, according to data from the Centers for Disease Control and Prevention 2020, or analysis of the data, which came from Centers for Disease Control and Prevention 2020, showed that blah, blah, blah. Now, why would you have this citation be in the middle of the sentence for the second example? Well, that's because it's identifying specifically where the data came from, as opposed to the analysis of the data. So if you were getting the analysis secondhand, you would have your citation at the end of the sentence. But here it's specifically giving the source of the data being referred to here, which is why it's earlier in the sentence. You can go ahead and look at things like the US Census Bureau, which contains a surprising amount of information. But that is the end of our formal presentation here. I hope that you have gotten something out of this, that you are more confident about how to cite and reference and big data, almost all of which is coming from websites these days. They used to have CDs that you could order and things like that, but in practice, it's almost all getting delivered online now, which is why you'll very rarely see a big data citation that doesn't involve a link to someone's website, because the information is being ordered and often accessed online. We have, again, just one more webinar coming up this term, Theoretical and Conceptual Frameworks. If that is relevant and interesting to you, I will see you next week. Have a good night.